So let's continue the conversation with Dr. Calvin Sun, founder and CEO of the Monsoon Diaries, also a clinical assistant professor and attending physician in emergency medicine in New York City. Dr. Sun, it's great to see you again. Let's just start off with the comments that we got from Dr. Fauci, that timeline that he put forward, getting some control of the virus by the spring of 2022. What do you make of the timing?
It all depends on what we do right now. I think we said back in March and February when I was on this program, the inflection point of how many people get vaccinated, how quickly before variants take over is, we'll have an impact on where we are right now in the summer, which we see it's neck and neck with Delta. But where I am in New York City, the people who are doing really, really well are all vaccinated. The people that are struggling, who need to be admitted to the hospital, who need oxygen support, most of them are unvaccinated. And all it takes is a few unvaccinated people to get sick with a variant and then to mutate it into a different one. And so with Fauci's timeline, it really does depend on how many people we get vaccinated, which he said as his condition. If we get as many people vaccinated as quickly as possible, reduces the chance of another variant being created in an immunocompromised, unvaccinated patient, so that we don't have to deal with this again for the next future. So it really depends.
Dr. Sun, many of us turn to doctors like you just for reassurance, and there's a headline today. A fully vaccinated passenger, we're told this individual is fully vaccinated, aboard a Carnival cruise line, contracted COVID. There was a breakthrough case, and that individual, unfortunately, has died. Now, we don't know if there was an underlying issue. We don't have the circumstances. But I imagine you're going to get a lot of your patients saying, wait a second, we have someone who was vaccinated who died. What is important for us to consider? Given, I realize we don't have too many details, but those of us who are vaccinated, about the risks that still exist because of COVID-19.
It's like reading the news that somebody was wearing a seatbelt and then died in a car accident, or somebody was wearing a bulletproof vest in Afghanistan and got shot and had to go to the hospital, and a few died. So does that mean I stop putting on a seatbelt? Does that mean I start questioning the efficacy of bulletproof vests? I mean, to believe that bulletproof vests can solve gun violence or that seatbelts prevent car accidents, I don't even consider that a breakthrough case if someone is positive COVID who have been vaccinated. I mean, the vaccines are designed, even looking in the dictionary, it's to lower the chance and prevent the spread of disease, not infections. So seatbelts lower your chances of death and you get into a car accident. Bulletproof vests lower your chances of death, you get shot. Helmets lower your chances of death if you get a brick to fall on your head in a construction site. Does it mean that if somebody would to die from head trauma while wearing a helmet means that I should doubt the utility of helmets? I'm still going to put on a helmet, put on a seatbelt, and a bulletproof vest. So we don't have the details of that. But what we do know is that 99.96% people who have died in the last couple of months are unvaccinated. It's not 100%. So what are the odds that you are want to deal with if it comes to the game of life, the poker game of life, where you are really betting against the house if you start to question the efficacy of vaccines when the overwhelming evidence show that it is actually doing its job, lowering your chances of death, severe symptoms, and hospitalizations. And those of you who consider about asymptomatic spread, a lot of them do end up developing long-haul syndromes, these unvaccinated folk. 1 in 4 adults who are unvaccinated develop long-haul syndrome. It's considered a disability in the ADA. So do you really want to risk that when Yale Medicine has shown that people who get vaccinated with long-haul syndrome are shown to have improved? So, I mean, again, if you want to question that, you're betting against the house. You can double down all you want, but you might lose everything. When maybe it's just better time to fold and come into the ER and get vaccinated secretly, even if you're against them, which is what we're seeing a lot.
Yeah, Dr. Sun, those who are unvaccinated is a big reason why we're seeing a situation that's so dire in many of those southern states. Kentucky, for example, bringing in the National Guard. They've been called in to help overwhelmed hospitals. We just saw Florida doctors staging a walkout amid the surge that they've seen in unvaccinated patients. I'm curious just to get your point of view on this as a health professional, just what the current, mindset or what the current state of medical professionals are in right now, because 60 months into this pandemic, you have to be feeling exhausted, the fact that so many people are still not getting vaccinated.
Moral injury is another term that we apply to something like burnout. We still do our jobs. We go into work. We swear an oath to our patients. We live and among a team of professionals across the country who have learned to put others before ourselves. The wounded healers, that's something we learn in medical school and residency. So it becomes habit to always put others before. I mean, you look at the walkout. They walked out for a temporary amount of time, and they had to go back in to take care of their patients. It wasn't a real walkout where they boycotted the hospitals and they had to shut down for a whole day. They eventually went back to work because they put their patients above themselves. And these are the same patients who do not believe in the vaccines or medicine and yet still go to hospitals when they get sick. What is it to really expect them taking up hospital beds because they have to be admitted when they could have avoided that by being vaccinated? But now somebody with cancer, somebody who needs chemotherapy, somebody who gets in a car accident, someone who slices their hand open now has to wait hours and hours to just be told to turn away, to be turned away to a different hospital, or to keep waiting because the hospital's full of unvaccinated patients who have gotten sick with COVID. 99% is what I was saying. It's not 100%, but these things all can be avoided. That 99% can be zero if enough got vaccinated, so that we don't have to take up these hospital stays. So of course, we're morally injured and we're burnt out.
Some of us have already scheduled or at least put on the calendar our booster shot date, 8 months after the second shot. But you said something just a minute ago that made our ears perk up. Secret vaccinations. Do you actually have people who are coming in don't want anyone to know that they got vaccinated?
Oh, patient privacy is a wonderful thing. It's called HIPAA. They don't have to tell anyone. We don't have to tell anyone. The patient-physician relationship is beautiful. I'm not identifying who it is right now. I just can speak on behalf of what we are seeing across the country. You go up New York Times, little article in Missouri. People are literally dressing up and putting on a disguise to walk into pharmacies to get vaccinated and telling and begging the people vaccinating them, whether they be pharmacists or ER doctors or people in the clinics, don't tell my friends. I've seen it myself in New York City, very rarely because it's New York. But when I read about it, what's going on in Missouri, as well as my colleagues around the country, it's a nationwide thing. All of us are seeing this because people are realizing that you can have your cake and eat it too. Keep your friends; they don't have to know, and you get secretly vaccinated. People out there who don't believe in the vaccine, they're among you.
Dr. Sun, we really appreciate you taking the time to join us. We learn so much every time you're on, so thanks so much, and we look forward to having you back again soon. Founder and CEO of the Monsoon Diaries, also a clinical assistant professor and attending physician in emergency medicine in New York City.